Hey guys, this is Mody from Trekk, and today we're going to be talking about something very important and I think should be one of the priorities for when you go packing for your camping or your hiking trip. It's your first aid kit. Now, I'm a registered nurse in the state of Illinois. I'm trained in CPR, BLS, ACLS, and just like you, I love going outdoors. I love going kayaking, camping, spelunking, hiking, and all that jazz. But as a medical professional, I get asked what goes on in a first aid kit. So today, I'm going to be showing you what to pack in a first aid kit and how I pack for my first aid kit based on the common outdoor emergency. So we actually have two first aid kits. One we take for when we go hiking for a day trip, like say 4 to 8 hours of hike, and then one we leave at base camp when we go camping for several days. Just a disclaimer though, my first aid kits are not tactical survival trauma kits. They're basically designed for non-life-threatening common outdoor emergencies. But in my next video, I'm going to be making a trauma kit and also be giving suggestions on what items you can add to this first aid kit in order to make it into a complete trauma first aid kit that you might need. So watch out for that soon. For now, if you're just going camping or hiking and you don't expect to encounter blades, guns, or bear attacks, this video is for you.
Let's start with tip number 1. Get a good first aid kit container. It should be clean, it should be closed, it should be made of waterproof or water-resistant material, and it's ideal to have compartments or pockets for organizing your items. If you don't have a waterproof or water-resistant pouch, you can waterproof your items by packing them in Ziploc bags, so if in case it gets wet outside, they're still dry and safe inside. Also very important, your first aid kit should be easily identifiable, like a solid color. It doesn't have to be red, but it should have a bold label on it that says first aid.
My rule of thumb is your first aid kit should always stand out in a sea of bags so that everybody will know where to go to in case of an emergency.
Now that we have our first aid containers, let's figure out what to put in these.
Tip number 2, you should know the first aid kit essential components.
You should have items for wound care, including burn care, musculoskeletal care, and treatments for chronic illness attacks and acute discomforts, which includes your prescription and over-the-counter meds. And of course, you can't forget about your basic first aid tools.
Every good first aid kit should have these core components. Now that you know that, I'm going to show you which items go for each core component. Disclaimer again, this is not a sponsored video. Every item that I will be introducing or recommending in this video is solely based on my positive experience on the item. So please don't come back at me if you have any unexpected side effects or allergies to any of the items that I'll be showing to you. Thank you.
Let's start with the first component. For wound care, we will be preparing for minor injuries like lacerations, cuts, and splinters, also burns. And the generic first aid of these injuries is to clean and cover. For burns, it's to cool and cover. So when you're packing for your first aid kit, tip number 3 would be to separate the cleaning pack from the covering pack. This is important because you want to get to your cleaning supplies first before you fumble around for covering supplies with your dirty or bloody hands. We want to keep the covering supplies clean or sterile as much as possible. The covering pack we will be dividing for the regular wounds and the burn wounds. First, let's see what goes on the cleaning pack. So now you're going to see the difference of how I pack the cleaning supplies for my two first aid kits. On this side, I'll be placing the items for my hiking kit, and on the other side, I'll be placing my items for my base camp first aid kit. First up, I'm going to need some trash bags and tissue paper or paper towel. Before I even start cleaning, I open these out so I have somewhere to throw away my soiled items. I can wrap up the bloody or the dirty items in tissue paper so I don't accidentally touch it when I throw it away. Also, I'm keeping one for my hiking and one for my camping kit. Next, I'll need something to clean my hands with, so I'm bringing 70% isopropyl alcohol in my camping kit. It's in a squeeze bottle, so it's very easy to dispense. For my hiking kit, I'll be bringing these hand sanitizing wipes or hand cleansing wipes to save on space. Next, I'll need something to disinfect my tools. Again, these hand cleansing wipes contain alcohol, and I prefer using these to disinfect because it doesn't drip everywhere when I wipe it on my tools versus using the alcohol in a bottle. Since I already have my hand wipes on my hiking kit, I won't be adding any more supply for this purpose. If you have existing alcohol pads, these can work too, although they're very small, so it's kind of hard to wipe with it. Next, we'll need an antiseptic. This is what we'll use to clean the wound. For my camping kit, I'll be using the Bactine antiseptic. I place it in a small spray bottle so it's easy to dispense, and this has 4% lidocaine, so this helps numb down the sting when we're working around the wound. This is also good for other minor discomforts like sunburn pains or bee stings. Another antiseptic option is povidone iodine. This comes in packs and they're really good antiseptics. The downside is when they get dry, it can be irritating to the skin to some people, but we don't have any reactions to it, so I'm bringing along our hiking kit. Another good antiseptic is of course alcohol, but nobody really likes that on an open wound. And lastly, I would advise against using hydrogen peroxide because its cleaning power is too strong that it can also be toxic to the surrounding tissues of the wound. So you can clean with any other clean or sterile water, or some clean or sterile normal saline. So bear those options in mind for your antiseptic. Then we'll need an antibiotic for infection prophylaxis, which is a fancy way of saying we're trying to prevent infection. I have two of the most common ones, a triple antibiotic ointment of bacitracin, neomycin, and polymyxin in one ointment, and I'm keeping that in the camping kit, and Neosporin, which is also a good antibiotic. It has the same compounds, but the difference is Neosporin has more of the compounds that can kill an existing infection, so it prevents and kills at the same time. And for that, I'm keeping it on my hiking kit. Then we'll need some applicators. These are items that we use to clean the wound, absorb the blood or pus with, and apply the ointment with. My first option is always some clean gauze balls. These are just rolled up 2x2 or 3x3 gauze pads, and we use this in surgery, but they're super absorbent. So I'll bring 2x2 clean gauze pads for the hiking kit and the gauze rolls for the camping kit. I'm not a big fan of cotton balls because sometimes they leave some fibers on the wound, but apart from that, they're pretty okay. For finer jobs, we use cotton tip applicators. And lastly, for my cleaning pack, I'm going to bring my nitrile gloves. These are just clean gloves. I'd advise you to use nitrile or vinyl gloves or any non-latex gloves when handling infected and bloody wounds. Let's just avoid using latex products because though you don't have any reactions to latex, if you're helping out a stranger and he's allergic to latex, you will put more harm than good. Also, we always bring a hand sanitizer when we're out doing activities anyways. I can always use this to disinfect my hands, so we'll keep this with our hiking supplies. I'll store it out of the kit. So that's it for our cleaning pack. Now let's talk about the cover pack. Our cover packs will have supplies for patching up regular wounds and covering up burn wounds because yes, there is a difference. Let's start about what we bring for a regular wound dressing first. Now the number of pieces I'm going to bring will vary on the kind of activity we'll be doing and for how many people this kit might cater to, but I always carry at least 2 or 3 pieces of each item as a base. Let's start with my gauze pads. I have a standard sterile 4x4 gauze for each kit. I'll also bring smaller sizes, 3x3 and 2x2 sterile gauze pads for each kit. These will be the ones I'll most likely use the most. I also have clean freeform gauze rolls for wrapping up wounds on the limbs and head. Aside from being absorbent, they can also provide some compression if there's bleeding, so I'll bring one for each. Then we have some band-aids of different shapes. I'll make sure to prioritize the small ones that I can find because for bigger wounds I'm going to use the gauze pads for covering anyways. So I'll keep the band-aids for the really small cuts so I don't have to bring a lot of it. And then some clotting powder. These are from Wound Seal. These are for if you have deeper cuts with some bleeding that you can't seem to slow down with compression. Remember, compression is always the go-to first aid for bleeding, so only resort to clotting powders or tourniquets if it's not working. Next up, we have steri strips. These are the tape versions of sutures, so you don't puncture your skin and won't give you suture scars. Now, unless you have medical training and you absolutely need to do it, I do not advise anyone to do sutures outdoors because it's not a clean or sterile environment, and then you'll add to the infection risk. Then we have some waterproof dressing. This is the transparent dressing you see on your IV side in the hospital. So if in case you're out kayaking or it's raining or there's a high chance of getting the wound wet, let's use this just to be safe. And lastly, we have an eye patch. Now, this is not a necessity because you can always make one with a sterile gauze pad anyways, but if you happen to have one around, just bring it along with you for your potential eye injuries. The second half of your cover pack consists of your burn supplies, so tip number 4 is to separate your burn pack. Again, the first day of any type of burn is to cool and cover the wound loosely, but the type of dressing will depend on the type of burn you have. Now, if I have first-degree burns and I don't have a steady stream of cool water, these cooling strip bandages from Curod would come in handy. And because these have some analgesic to it, it also helps with the stinging pain for a while. So I'll keep some for a campsite and one for my hiking kit in case I get stuck in the woods overnight with fire. If I have a second or third-degree burn, open wounds, or deep scrapes on my skin, after cooling and cleaning, I'm going to use these Band-Aid colloidal covers. These can stay on for days and it acts like a second skin layer until your real skin heals and develops, so there's no scabbing. And then I have a non-stick sterile dressing, which is a special dressing for open wounds in general, but it's especially useful for loosely covering your burns or blisters. Now these are pretty much the dressings for burn wounds, but the gold standard antibiotic ointment for 2nd and 3rd degree burns is silver sulfadizine, under brand name Silvadine. I didn't show it here, but I'll be adding this to my camping kit as well. Next up, aloe gel or aloe vera gel, which is very good with sunburns. It cools it down, it moisturizes the skin, also has anti-inflammatory properties, so I carry them around in both kits. Next, we have moleskin tape. It has a little padding and it's perfect for skin hot spots to prevent blisters, which can come from a form of a friction burn. And then finally, we have Luca tape. I can use this to make an island dressing, especially for existing blisters. It's a very durable tape and it comes in a big roll, so I just stuck 2 or 3 feet in some wax paper strips, and it made it really easy to cut the tape this way because this can be a real pain for me to cut since they're very sticky. So these are the important burn supplies that we'll use, and that completes the cover pack. To care for musculoskeletal injuries, the second component of your kit, we're going to prepare for cramps, soreness, fractures, sprains, or strains. So tip number 5 is to pack hot, cold, and compression supplies. Instant ice packs are great when I'm out hiking and I don't have a readily available ice source for my sprained ankle or for heat stroke, for example. Just squeeze in the middle and I'll get a solid 10 to 15 minutes worth of cold compress, which is right about the recommended icing duration for acute injuries. Same with heating for cramps or sore knees and muscles, for example. You can get these instant heating packs for cheap, or you can use hand warmers. I've actually used this before for menstrual cramps on my lower ab and it worked wonders because they stayed hot for a long time. I also use this to warm up my toes on cold camping nights. Now for fractures and tears, it's important to immobilize the limb with a splint and some elastic bandage wrap. I'd recommend a SAM splint if you have it, but if you don't and you're out in the wild, just be resourceful. You can use whatever sturdy straight object you can find to immobilize the limb. But I do highly suggest that you have a good elastic bandage wrap or ACE bandage wrap with you on your kit. It's good for compression if you're keeping a splint in place. Next up is a triangular bandage, also known as a cravat dressing. It's a very multi-use wrap. I can use it as a sling in a swath, or for splinting, or even for pressure dressing. Now when I'm done hiking and I have all sorts of body pains, I use this Salon Pass patches. It's mainly topical analgesics and some muscle relaxant properties, so they work wonders. I used to use this after a long day at work before and it works every time. This one goes in my camp first aid kit. And that's it for my musculoskeletal care supplies.
Tip number 6, don't forget your prescriptions. Now if you have existing chronic illnesses like diabetes or hypertension, during intense exercise or intense weather conditions, these diseases will be exacerbated, meaning they could get worse, your symptoms could get really fatal. So please don't forget to bring your prescription meds and tell them that you have your condition so that they may be aware where you keep your meds and how to take care of you if in case some symptoms do get worse.
But aside from just bringing your prescription meds, just a general rule of thumb, if in case a diabetic or anyone feels woozy or lightheaded during an activity, they might just be hypoglycemic from excessive effort. So just bring high sugar candies or drinks. You can pack this up in your hiking bag or in your pocket, whichever is most convenient for you to reach it from. You can also bring electrolyte replacement packs to treat dehydration from an intense hike or from LBM or vomiting. Electrolyte drinks such as Gatorade should also be okay to bring along the hike to prevent dehydration altogether. Especially if you have diabetes or hypertension, I suggest you take sips all throughout your activity. For those of you with more serious allergic reactions, bring along your prescribed EpiPens during the hike too, and make sure to let someone know where you put your EpiPen as well. Now we're on to items that treat acute discomforts, the next component. Tip number 7, bring your comfort meds. These are just generic over-the-counter medications. I wrote the brand name, the generic name, the dosage, and the basic instructions and expiration date for each med. And both my hiking and my camping kits will carry these meds. We got Tylenol extra strength for fever and general pain relief. I have an Advil or ibuprofen. It's also an NSAID, also for minor aches and pains. The reason I have both is because of persistent minor pains. We have to rotate the medication to avoid their toxicity levels. Now we have aspirin for fever reduction, mild to moderate pain relief like joint pains. It's also the only NSAID for chest pain, so if someone's having chest pains, just give them a dose of aspirin. Now we got Aleve or naproxen sodium, also another NSAID for stronger pain relief. The one thing I like about this is we only have to take it once every 12 hours, so it's not very inconvenient. Then for GI meds, we have Imodium, your antidiarrheal, Bisacodyl or Dopalax to treat constipation, Dramamine, your anti-nausea, anti-vomiting for travel sickness, Tums for just general stomach discomfort, and some antacids for acid reflux. Then for your decongestants, we have Dayquil for cough, colds, and flu-like symptoms, phenylephrine for common colds without the cough, but just don't use this for more than 3 days straight because it might give you rebound congestion. We got Benadryl for your allergic reactions, a big side effect of which is it'll keep you drowsy, so keep that in mind when taking. Now on to tip number 8, prepare for outdoor discomforts. These are not necessarily medical emergencies, just uncomfortable situations that could hamper a good outdoor experience. So just to give you an idea on what kind of discomforts, I'll show you these additional things that I carry with me. Let's start with this Ivarest anti-itch spray. I just place some in a little spray bottle and it's great for poison ivy, oak, or sumac. I also have some cough drops for that pesky, dry, itchy cough and sore throat. Next, we have some hydrocortisone cream, a steroid anti-itch cream for mosquito bites. Also could work if you don't have the Ivarest spray. It helps with the itchiness as well. I also have some sting relief pads for my hiking kit to help numb bee stings. They also work well for mosquito bites if you don't have the cortisone cream. Then I have zinc oxide. It comes in a large tube, but I place some in a tiny Ziploc bag. It's for rashes and for skin protection when you get chafing for when you're hiking. And then I'm keeping these ammonia inhalation sticks. Just crack a stick and the smell of these things is powerful enough to make you alert when you feel drowsy or when you're out of focus and can bring you to consciousness when you fainted. So I'm keeping that for both kits as well. Then I have Visine saline drops to irrigate any eye splinters. You can also use clean water to irrigate, but I'm keeping this as well because I tend to have dry eyes without glasses. And if you're wearing contact lenses, this will help moisturize your eyes as well. Also bringing a bottle of antimicrobial eye drops. This is the medicated eye drops for pink eye prevention and treatment because you never know when some dirt or dust can inflame or infect your eyes. Next, I have a medicated hydrating lip balm. It gives extra moisturizing for chapped lips when you're camping in the cold or when you're dehydrated. I also bring a smaller one for my hiking kit. This one's from Birds and Bees. Then we have liquid bandage. I have a tiny one and a bigger bottle from NextCare. It's for cuts that are in awkward areas that you can't really put a band-aid around. These are not clotting sprays, so do not expect to stop the bleeding or for the cut to seal up. That's a common misconception. It's just a very thin film over your skin to cover the cut so you don't scrape on it too much. And then lastly, we have an emergency blanket. It's not only useful during the cold, you can also use it for shade if you're out under the sun for too long to prevent a heat stroke. Tip number 9 is to make sure you pack your tools at the most accessible spots. So here I have trauma shears or scissors that can cut through clothing. I also have a tiny one for more precise cutting works like cutting band-aids and stuff like that. Then I have tweezers for splinters. You can also use this for wound dressing. I also have a pen light. It's great for assessing any neural injuries after a head accident. It also doubles as a lighting source for doing first aid in the dark. This one is also a pen on the other side so I can use it to write down stuff. I have a medical tape. These are the hypoallergenic ones. I have 2 sizes here. I have a syringe for irrigation. Just fill this with normal saline or sterile water or just regular water when you're about to use it. I also have this multi-tool that I carry around on my hiking kit. I have an emergency whistle for my hiking kit. I have 2 KN95 face masks for each kit. I have a safety pin to secure my elastic bandages and also to pop large blisters. Again, only if you have to pop it. And then I have a lighter to sterilize my safety pins if I have to use it to pop the blister. I have a CPR mask. I still bring this along even when the current CPR guidelines only call for rescue breaths during the 3 conditions. I'll let you research those conditions. And then lastly, we have disposable tourniquets. Now these are not the tourniquets that stop the blood flow. We use this to control the blood flow, to slow it down until we get help. I will show you the other type of tourniquet in my next video, my trauma kit video, but even then I would still advise you to get training first before you even administer tourniquets because they can cause more harm if done improperly.
And that's it. That's how I pack my hiking and my camping first aid kits. Remember, no matter how sophisticated our supplies are, our first aid kit will only be as effective as our basic first aid skills. So I suggest we continue learning, we continue researching, updating our kit to make sure that it is complete, that it is not expired, that it is effective during the time of an emergency. Really get to know your first aid kit. I would suggest, especially if you purchased a pre-made first aid kit, that you assess the quality of the item because the last thing we would need is a very ineffective supply in case of an emergency. You don't want to get stuck with a dried alcohol pad or a tape that doesn't stick because believe me, that's happened to me before. That's it. Comment down below if you want me to show you how to use any of these items. and watch out for my upcoming video that I'll be making a trauma kit, tactical kit, survival kit. Don't forget to hit the like button and subscribe. Thanks again for watching. I'll see you soon.